A damning Amnesty International report shows 6 COVID-19 vaccine manufacturers are fueling an unprecedented global human rights crisis. It's by refusing to waive international property rights and share technology. It's pushing vulnerable healthcare systems in parts of Latin America, Africa and Asia to near collapse. We're joined by Amnesty International South Africa Executive Director Shanila Mohammed. Shanila, good evening and thanks for your time tonight. Look, there's been a long-held view, particularly by activist groups and NGOs like yourself, that Big Pharma is simply not coming to the party when it comes to questions about not just access to the vaccine, but global distribution. So what have you discovered now about these big 6 pharmaceuticals?
Good evening, Kathy, and good evening to your viewers. I mean, this Amnesty report, as you say, is damning. What we found is that these big 6 pharmaceuticals, and in fact all pharmaceuticals companies involved in the manufacture of COVID-19 vaccines, have really put profit before human life and before dignity of people around the world. And in fact, what our report found is the 6 pharmaceutical companies that you've mentioned, by the end of 2022, they will have earned in profit about 130 billion US dollars. So, I mean, clearly profits are more important than life. And again, we've seen the inequalities widen, Kathy, because the continents you've mentioned, which are South America, Africa, and Asia, these are the continents where we are seeing, less than almost 1% of the population has been vaccinated, whereas in these rich countries, 52% of the population have been vaccinated so far. And, until pharmaceutical companies and states change their behavior, we are never going to get out of this COVID-19 nightmare that we are all in.
Unfortunately, many of the efforts to date to try and equal the playing field have simply not yielded any types of results. And, one can even just look at the efforts by South Africa and other countries where the TRIPS waiver is concerned. There's been a lot of talk and commitment to support it, but the reality is the action behind it has not been as strong.
Absolutely, Kathy. And, again, we knew that there was massive inequality in the world. And I think what COVID-19 has proven to us is that, some lives matter more than others. So people in Asia, Africa, and Latin America's lives don't matter as much as people in the richer northern countries, according to the presidents and the states and the pharmaceutical companies. Now, today, President Joe Biden was about to launch an initiative in which he was pledging that 70% of the world should be vaccinated, by the end of this year or by 2022. Now, what we're saying is to President Biden and other rich countries is, there's no point in making these claims if you're not going to back them up with vaccinations or funding for vaccinations. While we are trying to get pharmaceutical companies to do the right thing, I think the rich countries also need to do the right thing. So President Biden needs to back up what he says today with billions of vaccinations that need to be sent to these 3 continents in order to ensure that the WHO target of 40% of people in these 3 continents being vaccinated by the end of this year is met. So again, there is stuff that we can do. We can force these countries to do what is right, because, the truth is, Kathy, until everyone is safe, no one is safe. So Americans may think they're safe, but until the rest of the world is safe, nobody's actually safe. So they need to do the right thing. They need to put human life before profits, and they need to stop prioritizing some lives over others. All lives matter, including people in Africa, Asia, and Latin America.
Let's talk about the case that you're making here from a moral perspective, and the burden that you believe rests not just on these countries, but also on these pharmaceutical companies when it comes to ensuring that they save as many lives as possible through distribution of the vaccines.
Well, we think that, in order to achieve a fair and equal rollout, the vaccine developers have to prioritize, first of all, letting go of the intellectual property rights of these vaccines. So, Amnesty International and a number of other organizations have basically joined in support of the South African government at the World Trade Organization in order to try to fight for a TRIPS waiver, an intellectual property rights waiver. And, on the one hand, that is happening. But on the other hand, they also need to prioritize delivery of vaccinations to these continents. We've got rich countries that are sitting on billions and billions of doses of vaccines, which is immoral, which is unethical. Why are pharmaceutical companies still sending vaccines to these countries when there are countries in Africa, Asia, and South America that don't have enough? And also, we don't want to take away the responsibility and accountability of the governments in Africa, Asia, and South America. There are a lot of people that are not being vaccinated. There are a lot of vaccines that are there and are not being utilized. So again, Kathy, it's got to be a joint effort. On the one hand, the pharmaceutical companies have to come to the table. The rich states have to come to the table, but also governments in Africa, Asia, and Latin America have to ensure that they are rolling out the vaccines in a way that people are actually stepping up and getting the vaccinations. So it's got to be a global effort. Otherwise, Kathy, truthfully, we are not going to come out of COVID-19 anytime soon. And of course, it's going to affect our health systems, which, as you said in the beginning, are being overburdened. South Africa already has a health system that is not serving the majority of its population. And we're seeing things like maternal health care, like cancer screening, like, other health things that are falling to the wayside as the healthcare system is dealing with COVID-19. Now, if people get vaccinated, it will definitely lessen the pressure on an already overburdened health system.
Amnesty International South Africa's Shanila Mohammed, let me thank you so much for your time tonight. Those figures are absolutely staggering. So this report also finds that, by 2022, BioNTech, Moderna, and Pfizer collectively would have made $130 billion. That's by the end of next year, just from this is just from procurements that are vaccine related, and that's why they're making the call for profits to never come before lives, a story that we'll continue to watch, and it's also big on the agenda at the meeting of the United Nations this week.